Well, thank you, Governor McMaster. I want to thank you and First Lady Peggy for the hospitality today. Karen and I are honored to be here with you, grateful for your strong and steadfast leadership throughout this pandemic, and as we see cases rising across South Carolina, on behalf of the President and our entire White House Coronavirus Task Force, Governor McMaster, I want to thank you for the seamless partnership that we have forged on behalf of the health and well-being of the people of South Carolina. But with rising cases here in the state, the President wanted me to be here today with a very simple message for the people of South Carolina, and that is we are with you, and we're going to work closely with your governor and with all your state health officials to make sure that the people of this state have the testing, the personal protective equipment, the therapeutics, and the supplies to meet this moment. And Governor, I want to thank you for organizing the discussions that we had today, having the opportunity to meet with your health team, to hear your perspective on what's happening on the ground in South Carolina, and the great efforts that healthcare workers are making all across this state, and the great cooperation of the people of South Carolina. I know that we'll get through this, and we'll get through this together. President Trump will be briefing the nation later today on our administration's efforts working with states, particularly across the Sun Belt, in the midst of rising cases. But let me just say a few words about our response. As Governor, you know, with the rise in cases across the Sun Belt is serious. But the people of South Carolina should know that we are in a much better place to respond to this pandemic across the South than we were 2 and 3 months ago. That because of the partnership we forged with your governor, with governors around the country, because of the whole of America response that President Trump initiated, that has taken testing to nearly 50 million tests having been performed across the country, the development of hundreds of millions of personal protective equipment, over 100,000 ventilators being constructed in 100 days, and the rapid development of therapeutics, whether it be remdesivir or convalescent plasma or others that are under active consideration at the FDA. That combined with the Operation Warp Speed's development of vaccines, we are leaning into this effort, and we are in a much better place to make sure that your governor and your health care providers in this state have the support and resources to provide any member of your family with the level of health care that we would want for a member of our family. We're proud of what South Carolina has accomplished. Governor, I think in March you were performing roughly 540 tests per day, now nearly 10,000 tests a day. And I also want to commend you, Governor, for the efforts you've made protecting the most vulnerable. From very early on, we've recognized that seniors with serious underlying health conditions represent those most vulnerable to the coronavirus. And to that end, Seema Verma in a few moments will detail a plan that we unveiled last week, building on our efforts to focus resources and measures and standards on nursing homes. We announced last week that the federal government will be distributing point-of-care tests, 15-minute tests, to all 15,400 nursing homes in America, beginning at the end of this week. And Seema Verma, with the Center for Medicaid and Medicaid Services, will describe that. With regard to supplies, I'm informed, Governor, that as of July 9th, FEMA and HHS have delivered to South Carolina nearly 500,000 surgical masks, not including nearly 400,000 N95 respirators, tens of thousands of face shields and coveralls. And we've also made certain that you will continue to have the ventilators here in South Carolina that are needed for people facing the most serious consequences. Seema Verma will also talk for a moment about healthcare capacity. We are monitoring healthcare capacity across the Sun Belt. And while there are instances where some hospitals in states that are being impacted by rising cases, there are instances where individual hospitals are beginning to reach capacity. The report that we received today here in South Carolina and all across the Sun Belt is that overall hospital capacity remains strong. Hospital beds are available, but we launched a new website this week to make sure that hospitals are giving us real-time information so that we can continue to work with states to make sure that that remains the case and that hospitals have the supply that they need. So beyond all of that, we're focused on saving lives, protecting our most vulnerable, but as we discussed today, we're also focused on reopening America, opening up America again and opening up America's schools. And Governor, I want to commend you for your steady efforts to put the people of South Carolina back to work. I'm informed that more than 105,000 South Carolinians have joined or rejoined the workforce in the month of June, and your unemployment rate in this state has dropped from over 12% to just under 9%. I think the American people and people across this state realize that when it comes to a choice between dealing with the pandemic or opening up America, it's not an either-or. We can do both. We all have a role to play. All of us need to do our part to practice personal hygiene, wash our hands, wear a mask wherever state or local authorities determine it's indicated or where their social distancing is not possible. But Governor, you're proving here in South Carolina that you can put this economy back to work, and you've already unveiled a plan to reopen schools across South Carolina, and that was much of what our discussion was today. And on behalf of the President and our entire task force, I want to thank you. I want to thank you for leading the way on getting our kids back in the classroom. We heard today from education leaders from across this state, and I was deeply inspired by the words that I heard. In just a few moments, I'll yield the podium to the superintendent of the Anderson School District 5, Superintendent Tom Wilson, today, reflected very memorably on the academic impact on children, especially children who are struggling learning how to read. The reality is that without getting our kids back into school this fall, children that are struggling academically, children that are struggling with learning how to read will fall farther and farther behind with long-term consequences on their academic future and needs. Also, I was deeply moved today to hear from Janie Neely, the mother of a special needs 4-year-old by the name of Marsh. Marsh has Down syndrome, and Janie spoke very eloquently about the fact that Marsh misses his friends, he misses his teachers, he misses the counseling that he receives as special needs students do uniquely in schools around this country. And so, Governor McMaster, we commend you for your efforts to get our kids back into school, and we commend President Castleman's efforts to reopen the University of South Carolina. We understand we don't want our kids to fall behind academically, as Superintendent Wilson reflected, but also it's so important to recognize, whether it's special needs, whether it's nutrition needs, whether it's counseling for emotional needs, millions and millions of children across this country rely on services that are only available at their schools. And so for the sake of their academic well-being, for the sake of their personal well-being, Governor, you recognize today, as your team did, that it's vitally important that we reopen our schools. It's also to reopen the American economy, we've got to reopen our schools. The reality is that for working parents, working moms and dads, there is a great hardship in children not returning to school. I heard a statistic on the way here that less than 25% of single parents are able to telework, which puts a great burden on their ability to both be a parent and also provide for their family. And hearing all that good counsel today, I just reiterated to the governor that we're going to continue to provide the resources and the guidance so that states like South Carolina can safely reopen schools as you reopen your economy and deal with rising cases across this state. I'm pleased to report, with a grateful nod to your congressional delegation, especially Senator Lindsey Graham and Senator Tim Scott, that we've already secured more than $30 billion in funding for states. $13 billion for elementary and secondary education and more than $14 billion for higher education. And I know, Governor, you just made an announcement about the distribution of those resources to school systems and universities here in South Carolina. I'll also pledge to you that our team is on Capitol Hill today negotiating and discussing Phase 4 of our recovery and relief legislation. And the President made it clear to our negotiators yesterday that we want education funding to be a centerpiece of any additional recovery efforts by the Congress of the United States. So more help is on the way, Governor, and we're going to continue to support your efforts and efforts across this country to get our kids back to school. And finally, we'll continue to give additional guidance. From early March, the Centers for Disease Control has issued consistent guidance for schools, providing additional tools for operating schools safely. And in the days ahead, the CDC will be issuing additional decision-making tools for parents and guardians, preparing K-12 school administrators for a safe return in the fall, and limitations and considerations on symptom screening and the like. That guidance will be forthcoming in the days ahead, and we look forward to providing that to you as well as to all the great education leaders all across this state. Finally, let me just say to the people of South Carolina what I said in the beginning. Is it on behalf of the President of the United States and our entire White House Coronavirus Task Force, we're with you. And we're going to stay with you every step of the way until we put this coronavirus in the past. We're going to continue to partner with your governor and with all your health officials and your hospitals to make sure our healthcare workers have the support and the supplies that they need to render health care to anyone impacted by the coronavirus. And we're going to continue to work in ways that can open up the state's economy again and get our kids back into school. But we all do have a role to play. We can slow the spread. We can flatten the curve. We can save lives. What we saw when this pandemic first struck our country was that with the full cooperation of the American people, with the full support of our healthcare workers, we can accomplish those things. We did it in the greater New York City area. We did it in New Orleans, in Michigan, and other places. We have every confidence that with the full cooperation of the American people, the dedication of our healthcare workers, with the strong leadership of administrations like yours, Governor McMaster, that we will do it again in the Sun Belt. But I do want to encourage each one of your citizens, as I said before, to heed local guidance when it comes to wearing a mask, or just wear a mask when social distancing is not possible. Wash your hands, practice personal hygiene. Each one of us has a role to play, and we'll get through this, I know, by putting the health of our neighbors first, looking after the future of our economy, looking after the future of our kids, getting our schools back open again. We'll get through this, and we'll get through this together.